these individuals are the planners, the AICP certified planners, who have really gone into the communities and charged themselves with meeting with the mayor, with meeting with the economic developer, really ascertaining the identity of each individual community to understand what makes that community work, what makes that particular hospital, what types of doctors are there, what makes it particularly valuable with respect to economic development and healthcare. And you're going to have other mayors, you're going to have other individuals around the state who are going to say, how do I get a master plan? How do I do this? How do I go out and recruit this industry? Well, these individuals who put these plans together are going to be able to tell you. Now, I'm going to introduce our moderator of this panel. She's my friend. She just became a member of the MDA team, but I've known her for a while since my days at MDA. Moderating this panel will be Marlo Dorsey, Chief Marketing Officer of the Mississippi Development Authority. Marlo oversees the state's marketing and communications efforts and is the agency's liaison with the Governor's Communication Office. Dorsey joined MDA in December 2012 after serving for 7 years as the Vice President of the Marketing for Jones County Junior College in Ellisville. Please welcome Ms. Marla Dorsey.
You know, Trey has really done a lot of work behind the scenes and in front of the scenes, and of course we want to thank him for everything he's done. And as you know, he said earlier he's moved on to Butler Snow, but I've been told that once you work for the governor, you always work for the governor. So, we'll expect to be seeing a lot more of you throughout this healthcare process. You know, the old saying also goes that if you fail to plan, you're planning to fail. And so we've heard a lot of really good things today, and I want to thank everybody for staying for the magnifier section of this, the economic development magnifier. When you put a really close lens on some of these communities, you can see we are already having success. This is happening. You're going to leave today and you're going to see all the headlines from today's event that there were more than 700 people here and that Mississippi is a pioneer governor in healthcare, and that's really exciting for all of us. So I know that this panel here has a lot of information to share, and we're standing in between you guys and the governor's reception, so we're going to keep things moving along. Our first member on our panel is Sean Garretson. And Sean is the president of Pegasus Planning and Development, which is a market analysis, land strategy, and development services company for public and private sector clients. Sean received his master's in community and regional planning with a specialization in economic development at the University of Texas, where he now serves as adjunct faculty. Sean, we will not hold it against you that you're from UT, not today. Okay, so but please come on and up to the podium and welcome Sean.
You know, I also want to thank the governor for this initiative. It's you know, we work all over the country, and this is very unique. We also do a lot of work in the state of Texas, and I can say there are definitely similarities between you and Governor Perry. You're both very aggressive at economic development, and you both rock the heck out of wearing cowboy boots with a suit. So, congratulations on that. You know, I made the mistake of leaving my notes and my notebook in this room during lunch, so if anybody happens to find that, please tell me if I get off cue. As she said, I do live in Austin, Texas. I live about a block away from where the new medical school in Austin is being built, and I happen to represent our neighborhood in negotiations with the University of Texas on a lot of different physical planning aspects, and I can tell you that they are looking at that as a talent attraction tool. It's not a medical school, it's a mixed-use park with a medical school in the center of it. So I think a lot of the comments, Governor, that you made and that I've heard today, I think you're right in line with thinking about quality of place and healthcare as economic development. So I'm not a healthcare expert, but like you've heard from some of us today or others, my father was a hematologist and an oncologist, and you know he passed away about 5 years ago, and I had the pleasure of giving his eulogy, and you know I recanted the story of when I was in 7th grade, and like a lot of us, I was you know a skinny, non-popular, geeky guy, and this one day at school, well the night before I went to school, my father was on local and national television graphically demonstrating how he was getting ready to do this new level of breast exams. And so I go to school the next day, and immediately I had popularity among the whole football team. They're all giving me high fives like, yeah, I saw your dad last night. Anyway, I had a little bit of exposure to healthcare when I was growing up. But that is not my specialty. So economic development and planning is my specialty. And we've had the pleasure of working in 9 of the 12 communities that you've heard about today and putting together 9 of those district plans. What I've been asked to do is to kind of frame some of the issues and the opportunities, because there are definite opportunities. Now this chart on the lower left, you've seen before. My partner in crime at Broadus Planning, Stephen Colson, down here in the front, he also shared that, and we think, as I get older, I think redundancy is kind of a good thing. But it illustrates that baby boomer growth as well as the healthcare growth. Healthcare growth is outpacing population growth. Now, I'm the youngest of 7, good Catholic Irish family, and all of my siblings are baby boomers. I'm not quite a baby boomer, not quite that old. And I can say that baby boomers, it's not because it's the fastest growing segment of our population right now, but it's because of their lifestyle. They believe, like probably many of you, you can live into your hundreds, probably false, and that you'll be able to snow ski, snowboard, and everything else. So all the medical device companies love that aspect of baby boomers. It's going to continue to produce a lot of opportunities for medical device companies. The other thing is manufacturing is definitely on the rise. And for those economic developers in the room, I think you know that. There's something called nearshoring, onshoring. A lot of those jobs are coming back to the United States. But we still remain in a very competitive environment. I think Mississippi, though, given that you are a right-to-work state, you're going to be able to continue to benefit from a lot of those companies that are looking to come back to the United States or close to the United States. But what are we competing with? We are, as an economic developer, as everybody in the room will tell you as an economic developer, this is an international game. It's not that you're just competing against Louisiana or Alabama or Texas, for that matter. This is, I don't know if you've seen this map before, this is a Trans-Siberian Railway that opened up several years ago. What's significant about this, I'll give you an example. Hewlett-Packard has now decided, they do have operations in China. They've decided not to use air or boatways for their freight traffic. They're now using this. It decreases their costs by 2/3 and time to market by 2/3. That, and you have the Panama Canal expansion opening up, and I know you all are gearing up for that along your ports. While that's great for your ports, keep in mind it also allows businesses to continue to be overseas, and because their labor costs are so low, they can make those numbers work if they can get their products to the United States and markets in time. Now, as this chart illustrates, our labor costs are really are really high relative to a lot of the other countries that you can see on there. We're about $38 per hour on average for our labor costs. You compare that to China and India that are $1 to $2 per hour. That's difficult to compete with. So that's the framework I wanted to put out there to you all. Now, Mississippi, you fare very well. I think from a comparative advantage, you do very well. While you might not lead the country right now in job growth, you are on a positive uptick. And you can see the lower left, the site selectors continue to rate you in your top 10 for a couple of years. So you're doing a lot. You have, I think, very good leadership at the top level. And the communities that we've been working in, obviously they understand economic development. But keep in mind that international perspective and how competitive economic development is. So I like very simple graphics. You've seen a lot of graphics today. There's basically 3 initiatives, right, that have all come together to put these local healthcare industry development and plans together. The Home Corps, Mississippi Healthcare Industry Zone Act, Mississippi, the Blueprint for Healthcare, all have come together. I'm going to focus just briefly because I can see the clock ticking down. By the way, we only have 6 minutes each, so you don't have to see me up here much longer. But these are the 9 communities that we've been working in across the state of Mississippi, and very diverse. Belzona, you heard, I think the governor mentioned that today, catfish capital of the world. Ironically, they're no longer the catfish capital of the world. I don't know if you know that or not. Because of Alabama now producing more catfish. Belzona now produces fingerlings that go into the lakes. But Belzona has 45% of their population below the poverty level. Keep that in mind. We have a lot of other communities that we worked in that fare very well. Stephen and I are actually driving down to Bay St. Louis tonight for our final presentation to that community. They have done very well post-Katrina, and I think they're very well positioned to take advantage of this. I'm not sure if you're going to be able to see all of those numbers. It illustrates the job estimates and the equivalent square footage numbers that are going to be demanded for all of those jobs that we know are very doable in terms of healthcare jobs for each of these healthcare plans that we've put together. I'm gonna breeze through some of this. I think Sonny Simmons and the mayor did a very good job in this. Batesville does not have a whole lot of manufacturing or distribution of healthcare product employment. This is their existing employment right now. They currently have about 1,200 employees. We're predicting about 780 new jobs in healthcare, many of which are going to be in manufacturing and distribution. I just want to end by saying, because I'm down to zeros over there, that in terms of implementation, I do think there's several different things that need to be done. I think for a lot of the communities like Belzona, Yazoo City, they do not have enough resources to implement the plans, even though, as an example, for those folks in healthcare industry that know Fresenius, would you care to guess where the North American director of Fresenius is from? In Belzona, Mississippi. That seems to be really low-hanging fruit for the state of Mississippi to go after Fresenius and get them to bring a manufacturing or distribution facility in Belzona. The last thing I'm going to say is, while that 5-mile radius you've heard about, I think has been very great, for communities like Hancock County and Bay St. Louis, that really only captures about a mile because they're right on the coast. I know that Hancock County is going to be interested in seeing about tweaking some of that legislation for some of the coastal communities. But that's all I have to say. Thank you very much.